Okay, Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ojib bin Zulkifli. So I want to present to you my final project for blood glucose monitoring for diabetic patient. I'm using a non-invasive type. So my matrix number is CE170020. My supervisor name is Dr. Muhammad Nazib bin Adon. My panel is panel 1 is Prof. Madia IR Dr. Sun Shifong, and panel 2 is Dr. Farhana Hani binti Mahmud. So the introduction of the diabetes is one most common lifelong chronic disease in human being. It is mainly caused by genetic factor, immune disorder, and other factor on the human body, leading to islet function decline in insulin resistance, resulting in imbalanced glucose level in the body, which is manifested as failure of glucose metabolism and hyperglycemia. Diabetes is divided into two categories, type 1 and type 2. Differential secretion of insulin in the pancreas lead to diabetes type 1 and type 2. On the other hand, it's mainly due to ineffective use of insulin caused by the insulin resistance and insulin sensitivity decrease in patient. Diabetes has a high incidence rate, numerous complication, and wide pathogenic factor difficulty in and curing and causes other serious hazard in human health. Therefore, many related field has been actively devoted to the research of diabetes. So for the problem statement, diabetes mellitus is one of the world's most frequently life-threatening illnesses. Malaysia is ranked 10 in the world for having the largest number of diabetes. WHO 2030. The effect of diabetes can only be seen 6 to 12 months after high blood sugar, which can lead to other serious health problems as kidney failure, heart disease, blindness, stroke, and the neurological disease. According to WHO, diabetes is serve and growing worldwide health problem. An estimate of prevalence are critical of resource allocation and trend monitoring. Diabetes is a global major condition that can only be postponed or prevented if BGL and BG concentration level are monitored on the regular basis. Continue monitoring solution help participants to plan their diabetes treatment approach and avoid long-term illness consequences. Although there is no cure for diabetes at present time, proper blood glucose management will continue glucose monitoring can help patient avoid problem. So this is my objective of the project. First is to develop blood glucose monitoring based on NIR sensor. For NIR sensor, I use IR module series sensor, which is very good for the very good wavelength, and it is suitable for my project. Second is to analyze and verify blood glucose level for diagnosis, and we are analyze verify blood glucose, which mean I already test it by using glucose meter at healthcare center, and I have proof that my project has synchronized result. So the third is to validate blood glucose accuracy. So validate blood glucose accuracy is for the result must be contain comparison between the non-invasive type and invasive type. So the scope project is feather and function design phase. Three main components that will be used is an IR sensor, Arduino, and LCD display. Feather can that may applied in this project, testing on finger and analyze amount of glucose data. Algorithm phase will be programmed through Arduino software. So the literature review and IR spectroscopy based skin tissue blood flow management system. Signal from the NIR sensor, the Arduino Uno will acquire the 810 nm NIR light intensity. So this is my methodology project for the project. So first we start, then design the project using sensor and IR with the LCD display and Arduino Uno. The next is system testing by put the tip of the finger into the NIR sensor. After that, we go to the system, start reading through the finger. If the is cannot if the sensor is not reading, we try to go back to the system testing, and we go back to put our finger to try get the result. So if yes, get the result, LCD display number of glucose in human body. So after that, we analyze the data through the as we analyze the data and compare it with the non-invasive invasive type. So this is a system design for the uh, Arduino, and this is my result. Based on my result, I will show the coding according to the result that I get, and I try to verify it. So the result is in the mini mode, which is I already use it, and I get the 5.06 millimole. So the conclusion is patient are instructed to obtain the blood sample by pricking their fingertip with the lancet. Spring load lancet are available. They are easy to use and cause minimal discomfort. Surprisingly, many patients consider and discomfort of the finger stick preferable or to the inconvenience and artistic unpleasant of obtain the urine sample for testing. A drop of whole capillary blood is then placed on the regenerative band to the proper street. Therefore, our goal to help patients to overcome their problem, which is creating new device to minimize the time taken and ready to use anywhere. Before I ended the session, I will show you the testing prototype that I get. Uh, thank you. So this is my coding for the glucose demonstrate for diabetes patient. So for the liquid crystal is called the LCD display, and this is anti time buffer for the okay, the flag, the IR value. For voltage, we must get the voltage first and then convert into the glucose. So this is for INT is uh, for the sensor unit, sensor declaration. So uh, we print as the blood glucose. So first overall we try to determine the IR value. Value we must get the analog read first. Then we use the voltage calculation. We use the voltage formula is IR value times with the 5 divided by 2 to 5. 2 to 5 is 5 divided by 2 to 5 is formula for the voltage, and with multiple by the 100. So we get the glucose. This is just for the constant number, and we must divide by the 17 because of we want to get into millimole unit. If we don't divide it, we will get the milligram. So 0.38 is from the equation y equal into y equal mx plus c. So this is for m, and this is for the c. So we get if we get the glucose for below than 4 and not more than 5.5, we get the normal state. So if the glucose above